Hi everyone, welcome back. So today I am going to be talking about how, whether you can have a massage treatment when you have a stoma, because there seems to be quite a lot of mixed feeling on this. There are approximately 120,000 people in the UK alone who have some kind of stoma. These stomas often are temporary, purely just to allow time for either the bowel or the bladder to recover following surgery or illness. And around 6,500 of, the 21,000 yearly stoma surgeries are permanent. So actually, there's a much higher percentage that are temporary. But, even despite that, adapting to life with a stoma can be very difficult. It not only will affect someone physically, but it can also affect them mentally, contributing to self-esteem issues, which can sometimes mean that they might avoid certain activities, maybe out of fear associated with their stoma. So maybe they are worried that they'll be in a social situation and the bag will leak or something like that. And massage is certainly an example of one of these activities that people feel that they should avoid. But really there's no reason, why a stoma should come between you and, your relaxation time. So, firstly, I want to talk about the three different types of stoma. The most common one, which most people immediately think of, is a colostomy. So, a colostomy, which you can see on the diagram here, basically is an opening in the large intestine here. Which is the last part of the bowel before you hit the anus. So an opening in the large bowel is created, and the healthy end of the colon, or the large intestine, is brought through an incision in the abdominal wall. And what this does is it provides an alternative means for feces to be excreted, either to allow the bowel to rest temporarily, following illness and surgery, or to act as a permanent artificial anus. And that's often the case, particularly in things, so if you've had, for example, anal cancer, that would certainly be the case. And so a colostomy is the main type of stoma, and that affects probably about 65,000 out of that 120,000 people in the UK per year. So that really is the most common one, and it's usually used, as we said, sort of in cases of colorectal cancer, but also cases of ulcerative colitis, sometimes Crohn's disease as well. They're the main sort of reasons why someone would have a colostomy. Now, the second type is an ileostomy, which affects about 45,000 out of that 120,000. So less common than a colostomy. But an ileostomy, you can see here, so this affects actually the small bowel, which comes directly down from the stomach. So it sort of connects the stomach with that large bowel that we've just talked about. So in the small bowel, this is where you've got food that is not quite as digested. It tends to be, if you look at the contents of an ileostomy bag, it's actually a lot more acidic and more kind of liquid than with a colostomy bag. So an ileostomy, as we've said, it's an opening of the small intestine, and it's created again just by bringing the healthy end of the ileum or the small intestine to the surface of the skin. Usually this incision is made on the right side just above the groin, and again it allows intestinal waste to be excreted before it reaches the colon. And then finally, less common type of stoma, which probably only affects about 10,000 of that 120,000 in the UK, is a urostomy. Now, a urostomy is where an opening is created to accommodate urinary diversion, where drainage via the bladder and the urethra isn't possible. So yeah, we're looking sort of down here just in front of the bladder, and this would be done in cases of bladder cancer where maybe there's a tumour that is either a tumour sort of in the bladder or that's blocking off maybe the urethra. So yeah, they're the three main types. Now, obviously in previous videos I've talked about numerous benefits, both physically and mentally, of massage treatments, but there are some benefits that particularly benefit those clients that have a stoma. So I'm going to talk about those now. Certainly we've mentioned, massage can really help improve self-esteem and body image, which, is important to anyone, but particularly if you've, just recently had a stoma. It can take a while to adjust, and it can affect how you, view yourself. So massage is great for just creating, more body awareness and just helping you to feel more confident, with the changes that are happening in your body. Another big benefit is that it can not only reduce the risk of adhesions after surgery, so by keeping those tissues from sticking together, massage will just help those tissues keep moving, and also it can help break down scar tissue in the late stage of the healing process. Potentially this can also contribute to reducing bowel blockages following surgery. We know that after surgery it can take a while for the bowel to kind of get moving anyway, and when you've had surgery that's handling the bowel as well, this is even more the case. Massage can also help not only with assisting with the passage of feces, but also with wind and just helping to move that around and push it out of the bowel. And wind can really, again, especially post-surgical, can really increase pain levels. And so by helping to get rid of that wind, massage can also help reduce pain levels. Also, it will help, we know it helps with circulation, and so by improving lymphatic circulation, massage can also help reduce edema, which can be an issue in those with a stoma, and also helps just to maintain skin integrity, and keep everything nicely moisturized, because when you're applying stoma bags every day, the skin around that stoma site can become quite red and sore. So massage, again, by its effect on circulation, can just help to maintain the condition of the skin. Now I'm going to talk a little bit about positioning when you have a massage, because I think that's probably the biggest concern for people who have a stoma. in terms of laying face down. But there are certainly ways that this can be worked around. As I say, it's probably the biggest obstacle that people feel stands in the way of getting a massage. But, as therapists, we adapt treatments all the time and positioning for other reasons, maybe for a pregnant client or Down syndrome clients, they don't tend to like laying face down. So there's no reason why, the same accommodation can't be given to those clients who have a stoma. The body and a stoma can actually withstand, a reasonable amount of pressure. But for clients who have maybe just recently, had their stoma fitted, it can take some time to kind of adapt and trust, that this is the case. So there are various ways that we can adjust positioning, and it's really a case of finding what each client, feels is right and comfortable for them. So one thing we can do is we can use the head cradle around the stoma, allowing the stoma bag to fall into the opening so that, it doesn't prevent output. And then use pillows on the other side of the body for support. Okay, so if this doesn't work, you could try doing the treatment in a seated position, or maybe using a maternity pillow to lift the body around the stoma site. And then, you could sort of effectively do it almost like a pregnancy massage. Or you could have the client laying flat on their front, but maybe they might just want to, place their hands under their hips to lift the hips up slightly. But really, all four of these measures are more to offer emotional support and reassurance to the client than anything else, because as I say, this stoma bags can withstand a fair amount of pressure. There are some other considerations when you go for a treatment. While you absolutely are under no obligation to tell your therapist that you have a stoma, certainly they can give you a much better treatment if they know, and that's because they can obviously adjust the positioning to ensure that you are really comfortable, but also that they have the knowledge of your anatomy and of any medical issues that have led to you having a stoma, which potentially could be, techniques could be adjusted to treat that issue better. So this is where, I talk about it all the time. Seeing a therapist who is, qualified and registered and who has medical knowledge is recommended, because they will understand the anatomy better. And also they'll understand the possible complications of having a stoma, and they're not put off by sort of what could be viewed as medical imperfections. Whereas if you go to your average spa therapist, their focus is more beauty orientated. So it's surprising how many, are not keen on these sort of additional medical sort of factors. They like everything, just perfect and beautiful. So, again, we've talked about feeling comfortable. And feeling comfortable during a treatment is really important. So, if something hurts or something doesn't feel right, tell your therapist, because they're really not going to mind, and, they will try to adjust things to make it more comfortable for you. So that's really it. There's not, as I say, there's not a huge amount that changes. It's really mostly about positioning and just finding a therapist that understands the medical side of things. But yeah, absolutely no reason why you can't have a treatment with a stoma. So what I will say is that obviously if you have any questions at all, as always, you can comment down below, or you can message me through my Facebook or Instagram pages, and I will do my best to help you. But for those of you who have maybe recently undergone surgery and are adjusting to life with a stoma, but also, for anyone even who's had a stoma sort of long term, I would recommend that you look up someone called Mr. Colitis Crohn's. He certainly has a Facebook page and Instagram page. I'm sure he's probably on here as well. But he actually has a lot of personal experience with dealing with stoma, and he's posted a lot of videos which are great at explaining those simple things that just make life with a stoma easier, and can really help you adjust, when you're in the early stages of having a stoma. And he, covers a lot of things that actually you don't really get from, the medical professionals. So definitely I'd say look him up. But yeah, as always, as I say, feel free to ask me any questions. But that is really it for now. So I will see you next time. Bye.